Good evening, everyone. A very warm welcome to all our respected
Can I
healthcare
increase the
professionals
volume?
and
Volume.
participants. I am Ada from IGCP, and it is my pleasure to host today's important webinar on the topic is the silent epidemic, erectile dysfunction in young men, observed in light of National Impotence Day. Eric, Erectile dysfunction is young men is an increasingly recognized yet often under-discussed issue. Beyond its physical aspects, it carries significant psychological, relational, and social implications. Today's session aims to shed light on the rising prevalence and underlying causes, early identification, and evidence based management strategies to help clinicians address this sensitive but critical concern more confidently. We are honored to have with us Dr. C. Sharad Kumar sir. He did MBBS, MS UK, DRCOG UK, PhD, super specialist in sexology and infertility. He is the director of Dr. Sharath Men's Clinic and Medivay Fertility Research Hospital. With his vast clinical expertise and dedicated work in men's health, sexology, and infertility, he brings deep insight and practical experience to this subject. Without further delay, I now like to invite Doctor to begin his session. The stage is yours now, sir. You can proceed with the next, sir. Thank you.
Thank you. Thank you. Good evening, all the doctors. Thank you very much, Ada, for a nice introduction. So, today is National Impotence Day. And this subject is very, very important from the point of youngsters because nowadays there is tremendous increase in the rate of infertility and sexual dysfunction amongst the young people, especially young men. That is because of so many factors which I am going to tell you. That's why unless we tackle this problem right now, one day there may be total disproportionate in the entire world population. Then there may be decrease in the demography of the young people. The world will be filled with the old people only, so such things can happen. That's why the National Importance Day is very important, and we have to tackle the sexual dysfunction in young men. And I'm going to cover this topic under the following chapters: introduction, definition, epidemiology, erectile dysfunction, causes, risk factor, investigations, treatment. So, sexual dysfunction. What is male sexual dysfunction? Male sexual dysfunction is disorder of the sexual behavior and sexual sensation that appears as an abnormality or absence of sexual psychology and physiological reaction in men. It is general term for many different symptoms, including erectile dysfunction, coital failure, loss of libido, and loss of desire. And what is erectile dysfunction? Recurrent inability to achieve an erection, inability to maintain an adequate erection, and noticeable decrease in erectile rigidity during the partnered sexual activity or masturbation. It's inability to complete the satisfaction of the sexual life. So these are the definitions of erectile dysfunction. And there are types of erectile dysfunctions. There are three types of erection: psychogenic erection, reflexogenic erection, nocturnal erection. And there are three types of erectile dysfunction. Primary erectile dysfunction: the man has never been able to attain or sustain an erection. Secondary erectile dysfunction or acquired erectile dysfunction, acquired later in life by a man who previously had perfect erection. And situational erectile dysfunction: inability of a person to get or maintain an erection under some situation. So there are three types of erectile dysfunction: mild erectile dysfunction, moderate, and severe erectile dysfunction. Erectile dysfunction and age. Overall prevalence is 52%, with the incidence clearly increasing with the age. At the age of 40, about 40% of men are affected, while 70% will report having an ED by 70. So, as the age increases, the ED increases. But now I am going to today's topic. Everybody knows, the media has reported, the newspapers have reported, the men themselves they come with so many problems. In my own practice, I am still seeing more and more young men coming with a problem of sexual dysfunction. The rise in erectile dysfunction among young men is growing concern. Studies indicate that nearly 1 in 4 men under the age of 40 now struggle with some form of the erectile dysfunction or the other. This increase is attributed to a combination of psychological, lifestyle, and medical factors that impact the sexual health. Younger men are more susceptible to ED due to lifestyle choices such as poor diet, lack of exercise, substance abuse, as well as mental health issues like stress, performance anxiety, and depression. Stress, performance anxiety, and even medications like antidepressants can affect young men's erection. Stress, as you know very well, that nowadays young men they enter the profession, they will have a startup, they will join as doctors, engineers, advocates, and software engineers, and regular engineers, civil engineers, mechanical engineers. So they want to come up very fast in their life. That adds to the stress. They want promotion quickly to assistant manager, manager, MD, like that. When the startup situations, they want to achieve the target much early. They want to become millionaires, billionaires by the age of 40. They want to build house. They want to have a, lovely car. They want to buy BMW. They want to buy the Benz car. All these adds to the stress and performance anxiety. They want to surpass their whatever the target is there. They'll be worried whether they will be able to achieve this target or not. That will rise to performance anxiety. And they start working about 12 hours per day, 14 hours, 17 hours, 18 hours per day, sitting in front of the laptop for hours together. That all adds to the anxiety, stress. Over the past decade, doctors report young adults and adolescents with ED have increased rapidly. One recent study has shown that a 31 times increase in young patients aged to 14 to 21 presenting in ED. Just imagine young boys reporting as ED. It's crucial for young men experiencing ED to seek professional help to address the underlying causes and improve their sexual health. So, friends, lifestyle and ED in young men. Junk food. Nowadays, hardly young boys, young men, young adolescents, boys and girls, they eat at home. They always go for pubs, they go for street food, junk food. They want pizza, they want burgers, and whatnot. High alcohol consumption, they go for starting the alcohol at a very early age. Drugs, drug abuse, cannabis, smoking, watching pornography for hours together, social media pressure. All these have changed the lifestyle of the young men, and all these factors can lead to sexual dysfunction in men. Now, coming to pornography induced erectile dysfunction. One of the most alarming causes of ED among men today is excessive pornography consumption. I'm not talking about routine pornographic viewing where everybody wants to view pornography, say daily about 10 minutes, 15 minutes, like that. But excessive use, that is, going on continuously watching pornography for hours together, day and night, that will cause lot of stress, mental worries, and can cause the erectile dysfunction. Studies have shown that watching too much porn can rewire the brain's pleasure system, leading to desensitization. See, if you go on watching the pornography, and ultimately the brain gets the pleasure by watching the pornography rather than the action. That is called as desensitization. Repeated exposure to artificial stimulation can reduce excitement in real life encounters. What happens is, in pornography, we see models, we see the man with a huge erection with 7 inches rod. We see the girl with perfect figure, 36, 24, 36, nice bumps, perfect boobs, so tight vagina. And all these make the life unrealistic, and the same thing will be expected from the partner also. This unrealistic expectation from the partner, looking at the porn, will lead to lot of problems, because there will be expectation failure. So one goes to the bedroom thinking that he can do or she can perform like that, like this, and ultimately nothing will happen. So they expect the same figure, same perfect body condition as their film heroines or film heroes, which is not possible in real life. That will give rise to excitement failure. Erectile issues with real partners. Many young men report difficulty achieving or maintaining an erection with the partner, but not while watching the porno. Why? That is because while watching the porno, unrealistic things are shown. Those have been filmed perfectly in the perfect studio environment. They are not real. They are not the real intercourse pictures or pornographic movies. They are all done under ideal conditions in a studio. The man would have been given an injection or a stimulant. The girl would have been dressed perfectly with wonderful lingeries and whatnot. Same thing cannot be expected in the bedroom. Increased anxiety and self doubt. Unrealistic portrayals in porn can create unrealistic standards, leading to low confidence and anxiety. See, in pornography, you see the man performing the intercourse for 30 minutes, 1 hour, like that, going on pumping endlessly, keeping the erection perfectly at 7 inches. These are all unrealistic. They are all models taken for this picture only. And even they show the camera in such a way that the organs are exaggerated. And many times they would have been retaken several times. That is not one performance. That's a continuous add up of so many cut films. So when we watch, we think that, oh, that man can perform so much. This lady is doing the oral so nicely, and she is able to take two penis, three penis, one in the mouth, one in the anus, and one in the vagina. So threesome, twosome, foursome. She is handling the rods, one on each side of the, one on each hand, and one rod she has taken inside the mouth, and another into the cunt, and another into the anus. So is it possible in real life? It is not possible. They have been pictured, taken movie in ideal circumstances, and hundreds of retakes would have been done while shooting that film. And that unrealistic imagination in the real life, it is impossible. So that unrealistic in the portrayals will make the person and to think of all those things, and in the real life such things will not come. That will lead to lot of disappointment, the depression, performance anxiety, and sexual failures. COVID, see, our young boys now, those who were exposed to COVID, lot of them have been affected by this pandemic COVID, and studies have shown that those who were infected with COVID 19 have got some factors that led to erectile dysfunction. So, what are the factors that cause erectile dysfunction in young men? Relationship factors, communication problem. The boy works in the day shift, the girl works in the night shift. Hardly they meet each other in the house, and even when they come, they will have a lot of work from home. And if they have got small kids, the girl will be busy with bringing up the children. The boy will be busy with communications on WhatsApp, on Facebook, and LinkedIn, and whatnot. All this will lead to the gap between the man and the woman, especially young men and young women, leading to differing levels of desire for sexual activity or violence. Hardly they don't have any time to meet each other, discuss the things because they have such busy life. Individual vulnerability factors, history of sexual and emotional abuse, existing psychiatric conditions such as depression and stressors, cultural and religious factors, inhibitions or conflicted attitudes regarding sexuality. Nowadays, intercaste, interreligious marriages are so many. There will be definitely difference in the way the boy and the girl would have been brought up in their younger age. So that difference in the cultural habits and things will definitely conflict between the boy and the girl, leading to lot of fights and violence. That will lead to sexual abuse and sexual dysfunction in both men and women. There are other risk factors which are common to all the ages, irrespective whether it's young or old. Risk factors like diabetes, dyslipidemia, hypertension, cardiovascular disease, obesity, and hyperchromistemia, lack of exercise. These are all common factors affecting all the men of all ages. Pharmacotherapeutic agents for cardiovascular disease like thiazide, diuretics, beta blockers, and others medicines can also give rise to erectile dysfunction. Arterial fibrillation, hyperthyroidism, vitamin D deficiency, these are all common factors and which can affect the ED for all ages. So we have this classification of the erectile dysfunction. They can be classified as psychogenic, vasculogenic, neurogenic, hormone induced, and drug induced. Psychogenic, it is caused by the anxiety. Anxiety may be caused by depression, guilt, previous sexual abuse, psychological trauma, performance anxiety, relationship problem, and patients with intimacy, problems with intimacy. Vasculogenic factors could be atherosclerosis, hypertension, and trauma. This is common for all the men of all the ages. Neurogenic, stroke, spinal cord injury, radical pelvic surgery, diabetic neuropathy, pelvic injury, common for all the ages. Hormonal hypogonadism, hyperprolactinemia can induce ED at all ages. Drug induced, especially in young men, anti-hypertensive, antidepressant drugs, anti-androgens, alcohol abuse, cigarette smoking. These anti-androgens, so many men, boys, especially young men, go for gym, and they give a lot of steroids for the growth of the muscles that can give rise to erectile dysfunction. How to go about? We have to first investigate the cause for the ED by taking history, physical examination, routine test, hormonal studies, color Doppler of the penis, and cavernous-sonography. And then treatment, general measures, nutritional supplements, psychosexual therapy, medicines, alternative treatments are available, surgery, complications of the treatment. So nutritional supplement, we have to give L-arginine, L-citrulline, L-carnitine, flavonoids, zinc, selenium, vitamin D, folic acid, L-methylfolate, and DHEA. And we have the psychosexual therapy is very important. We have to convince the young couple to change their lifestyle and remove the performance anxiety, go for sensate focus therapy, and the relationship counseling is very, very important in young couple. We have several drugs, oral drugs like phosphodiesterase type 5 inhibitors, that is called as PDE5 inhibitors, oral phentolamine, apomorphine, yohimbine, and we have several injections, intracavernosal injections, PGE1, papaverine, and we have intraurethral insertions of alprostadil. And we have several types of PDE5 inhibitors, sildenafil citrate, tadalafil, vardenafil, avanafil, lodanafil, microdenafil, udenafil. And we have got testosterone replacement therapy for those who have got the testosterone deficiency. Androgen deprivation has been shown to result in impairment of nitrous oxide, synthase release, altered PD expression and activity, impaired cavernosal nerve function, and contribution to veno-occlusive disease in the penis. Androgens are shown to have significant impact on the function of smooth musculature within corpus spongiosum. So intracavernosal injections, we have bimix, trimix, monomix, or prostadil, independent manual contraindication bleeding, and we have papaverine, phentolamine, aviptidil. So we can use all these things in one single injection or bimix or trimix. We have intraurethral alprostadil, which can be inserted into the urethra 15 minutes before the intercourse. We have several alternative treatments like platelet-rich plasma, low-energy shockwave therapy, acupuncture therapy, vacuum therapy, penile rings, vibrators. Vacuum pumps are available with constrictive ring that is called as vasoconstrictive device, and it gives the erection, and you can put the constricting ring to the base of the penis after attaining the vacuum that will give erection for intercourse. Platelet-rich plasma is a very good treatment which involves taking the own blood, processing it, separate the plasma and platelets, inject into the penis. That is called as PRP. Shockwave therapy, low energy shockwave therapy has been found to be very useful in the management of erectile dysfunction. Acupuncture, especially Chinese reports say that acupunctures have got rejuvenating effect over the pineal nerves, pudendal nerves, and it gives stimulation and rejuvenation of the pudendal nerve and pineal nerve, giving back the erection. External penile processes can be given when erectile dysfunction cannot be managed by any other methods. So, friends, ED is a growing concern among younger men, but the good news is that it is treatable and reversible in most cases. Addressing the underlying causes, whether physical or psychological or lifestyle related, can lead to significant improvement. So, most important thing in young couple is we have to understand why the couple has come with sexual dysfunction, and lot of time has to be spent understanding their lifestyle and finding out the real cause behind the ED. That is possible by only by couple counseling, individual counseling, counseling both boy and girl, that is man and woman separately and together. That will be very very important. And if you are experiencing is it's crucial to seek professional help rather than suffer in silence. So unless we educate the public that treatments are available for the ED, they go on suffering silently, thinking that nothing else can be done. Experienced specialist offers personalized treatment that focus on identifying the root cause and providing effective science-backed solutions. And don't let ED define your life. Take the first step toward recovery today. Call on a qualified sexologist. So, friends, if somebody is suffering from the ED, don't allow him to suffer silently about that. Give the relief by giving professional advice and professional treatment. So, thank you very much for your attention. And I sincerely thank the IJCP authorities, MedTalk authorities for giving me a wonderful opportunity to address my esteemed colleagues, especially on this National Impotence Day. Luckily, the government of India has opened the eyes towards the sex and sexual medicine and treatment of infertility and impotence. Otherwise, one day we will be left with only senior citizens on this earth and younger generation who are deprived of proper sex and proper fertility treatment. They may go infertile and impotent. So, thank you very much. Over to Ada. If there are any questions, I'll be extremely happy to
Yes.
answer.
Yes, sir. Thank you so much, sir, for this wonderful session, sir. With all your permission, sir, I'm going to take a question.
Yeah.
Okay, sir. So the
If
first
there are any
question is, sir,
questions, yeah.
yes, sir. So the first question is, sir, what early warning signs should clinician look for in young patients, sir?
Can you please repeat? Please increase the volume.
Okay, okay, sure, sir. So the
Yeah.
question is, sir, what early warning signs should
Ah,
clinician look for in young patients?
yeah, in young patients, see, most important thing is as soon as this young couple, men or women, they come with some sexual problem, immediately they should look for their lifestyle, whether they are spending properly the time with each other, whether the boy is in the night shift and the girl is in the morning shift, and hardly they meet each other for few minutes in the house, because even when the boy comes to the house, most of the times will be sitting in front of the laptop, especially with the laptop right on his groin, heat transmitting all the heat of the laptop into his testis and penis, and hardly gets any erection because he's most of the times he's online, is working from the work from home, and even little free time whatever he gets will be on chat box, WhatsApp groups, about hundreds of WhatsApp groups, and Facebook and LinkedIn and TikTok and whatnot. So whatever the little time, instead of spending with the loved ones, they will be spending with the mobile. See, this mobile culture and laptop working has totally altered the lifestyles of the younger generation. They have they are left with little time to spend with their loved ones, going for a cup of coffee in the morning with the friends, or going for a walk in the evening into a park. All those hardly we see. I daily go for the walking to the parks for morning and evening. Hardly I see the young men and women. Most of the times, what I see is the people of my own age, all senior citizens, all men and women after the age of 50. Why? Because the men who are the senior citizen now, we were not brought up with a mobile in the hand, hardly we had seen the laptop. So these senior citizens, they go for walking, for gardening, for cooking and other things. Whereas young men, those who, that is Gen Z, they are born with the mobile in the hand, and the young kids, without giving the mobile to them, they don't eat at all the food. So you should put on the TV or give the mobile phone, then only they will open the mouth. They are addicted to it. So, friends, I request all the doctors when the young couple comes, spend some time understanding their lifestyle, whether they are used for the junk food, used for the porn addiction, or have gone become obese, or they have got all these habits which I told earlier: smoking, alcohol consumption, cannabis, drugs. Find out the root cause and treat the root cause, not the ED. You need not treat the ED. If you remove the root cause, automatically within 1 or 2 months, erection comes back, because most of these things are reversible changes. So the only thing what you have to tackle is the lifestyle modifications. Over to Ada.
Okay. Thank you so much, sir, for this brief answer, sir. So the last question I can see, sir. Uh, what is your approach to treatment?
Ah,
When do you recommend counseling, medication, or advanced therapies?
yeah, very good question. See,
Thank you.
lifestyle modification, if you just say give and send, the couple will not be happy because they want immediate remedy. So there are two types of treatment when the couple walks in, or when the man walks in with sexual dysfunction. The first thing is counseling and lifestyle modification. But they will not be happy. They want immediate remedy first. So you have to tackle by two methods. Give some remedy for the time being. Say start with sildenafil citrate or tadalafil or avanafil, so that they will get their erection immediately by the pharmaceutical medicines. And meanwhile, start asking them to change their lifestyle, telling them, see, young man, this tablet is I am giving is only temporary. So as long as the tablet is there in your body, you get the erection. But once the tablet level comes down in the body, it won't work. So you will become addicted to this tablet, because without tablet you will not be able to perform at all. So how long you want to take? 1 month, 2 months, 3 months, lifelong? No. we cannot give lifelong medicines like this, because after 3 4 months the tablet you get, the tablet will not work on you, because the body gets adjusted to the tablet. Then you become resistant to the tablet. We may have to increase the dose of the tablet, because the tablet action is limited. So after 3 months, what 25 mg I am giving today, I may have to give 50 mg. So how long this will go? 3 months, 6 months, 1 year? So the best thing is I am going to give these medicines temporarily, but meanwhile I'll give you permanent remedy. The permanent remedy is lifestyle modification, diet, exercise, good diet with a lot of vegetables and fruits, fresh vegetables, and lot of fresh air, walking, gardening, skipping, swimming, and cycling. So, and reduce the weight if you have become obese, and to stop alcohol, stop smoking, stop abuse, drug abuse, and change the lifestyle by stopping the working for more than 8 or 10 hours per day. Go for recreations like the trekking, or go for the excursions, trips with the friends, with the loved ones, with the partner, so that there is change in the lifestyle and the body gets rejuvenated. So you have to look at short-term therapy and long-term therapy. Short-term therapy to give them some immediate relief. If you don't give relief, what happens? They will go to packs, they will go to medical stores, buy some tablet and take it. So once they start taking this Viagra and other tablets, they get addicted to it. He cannot perform without tablet. If there is no tablet, means no erection, because mentally the boy thinks that without tablet I will not get erection. So he goes on searching for the tablet. He goes all around the city searching the tablet, which medical stores is open at that time. Most of the medical stores would have closed at 9 o'clock. He wants to perform sex at 10 o'clock. They won't get the tablet. So he will become, again, he will go for depression. He will go for the anxiety, performance anxiety. So he thinks that without tablet I cannot perform. So he will have a lot of stress. So this will be a boomeranging effect. That's why, though. So I request all my doctor colleagues to tackle these people in two directions. One, short-term remedy to convince him that we are there to help him, and second, long-term remedy so that within 3 months, by lifestyle modification, he gets back his natural erection. Over to other.
Thank you so much, sir, for this brief answer, sir.
Volume,
Uh,
please.
yeah, thank you so much for this brief answer, sir. For
Hmm.
that enlightening and thought provoking session, sir, your insights into the rising prevalence of erectile dysfunction in young men and holistic approach to diagnosis and management have truly added immense value to our understanding of this silent yet significant issue. On behalf of IJCP, sir, I sincerely thank you, sir, for sharing your expertise with us today, sir. With all your permission, sir, shall I close this session, sir?
Thank you, Ada. I sincerely thank the IJCP authorities for this mid talks. This is a very beautiful platform. I really
Yeah.
enjoy this platform. I myself
Thank
listen
you.
to so many lectures by all other super specialists who share their thought provoking practical experiences in their specialities. See, India is a very vast country. All the doctors who are in the nook and corner of our country cannot go and attend the conferences. Conferences have become so costly. To attend one conference, one has to spend at least 3 days' time traveling, spending at least 50,000 to 1 lakh rupee for traveling and accommodation, flight charges, leaving their precious practice also. So instead of that one, this platform of sharing the rich experience of the super specialists in this platform will give an insight to all our doctors, so that we can share our knowledge. And myself, though I am a super specialist in sexual medicine and surgery with PhD, I still every day watch the what other specialists and doctors say, so that I upgrade my knowledge. And also, by giving such a lecture, I would have studied lot for 2 to 3 hours before giving the lecture to update my knowledge, so that I learn myself by uh, by pra- by giving the lecture. not only by giving the lecture, by adding the knowledge to myself. And the questions my doctors ask, they are all thought provoking, so that I open my
Yes,
eyes for the things which I wouldn't have even thought of. So thank you very much. Thank you. Good
yes,
night.
sir.
Thank you very
With this,
much,
sir, we
the other
conclude
for your
today's
nice
webinar, sir.
introduction and nice this
Thank you
one.
so much, sir. Thank you.
Thank you. Good night, Shubharatri.